Hi, good morning, everyone. Welcome to our Unit 4 discussion here in ST120. So we're going to be talking about a little bit more specifics into our sterilization process and the sterilizers themselves and what types of instruments can go in what sterilizers. It's a very important part of this job is to making sure that you understand those guidelines, these equipment, and the IFUs that go with those, because that's going to be like a daily thing for your job. So we'll talk about some high and low temperature sterilizers and the difference, pros, cons for each of those. Okay, so here are your assignments for Unit 4. So again, you have several of these smaller quizzes, but this week you have a research paper essentially. So it's worth 90 points. This MSDS research paper, I've had a few emails or a few questions so far about this, where it says you just need the first page of the picture of the SDS. So if you go to like Google or something and you search for, you could even type material safety data sheet, SDS, whatever, for your particular chemical, let's say Sidex, glutaraldehyde, okay? It will probably give you multiple pages of that SDS because usually they're quite long. They're 10, 20, 30 pages long, some of them. You don't have to put the whole thing, just like screenshot the first page. So I know you looked at it. You can see, you could go through and get some of your information from it. That would be handy. And just post that maybe at the bottom of your page of your research paper. Okay. So you'll need a few of those. So if you have any other questions about that paper, just let me know. Okay. Also, be sure to go back and respond to your peers by Sunday for your discussion posts. Those points that get taken off add up over time. Okay. So you don't want to end up like in week 6 or 7 and you're wondering how you can bring your grade up when you didn't respond to any discussion posts. I see that a lot. So be very careful with that. It's pretty easy to go back maybe Saturday or Sunday afternoon, whatever, and respond to your peers. Okay. All right, so point of use processing. Why is it important for central service technicians to stay up to date on best practices? So any job in the healthcare field is going to be one where you have to continually learn things. You're going to have to stay up to date with the changes. Healthcare is constantly changing. We learn new things. We've done new studies. New equipment is a big one. So in sterile processing, it's same thing. Industry standards change. Okay, they've done research, for example, on steam sterilizers that show, you know, it's not ideal to use what we used to call flash sterilizing. Okay, and instead we call that process immediate use steam sterilization because people were they had found that people were basically abusing the system, so to speak. They were using flash sterilizers inappropriately in instances in which they did not or should not have used them. They could have gone through the full decontamination, cleaning, sterilization process, which does take longer. But I have seen surgeons who are very demanding or antsy, or they want to get on with their day and they need it right then. Everything's right then, right? So they would put it in a flash sterilizer for the next case instead of going through the proper process. So they basically traced through time that you're more likely to have SSIs in those cases if you're not properly decontaminating an item for the next case. You're definitely going to increase the patient's risk for infection, and we don't want to do that. So instead of saying flash, like you can only use it if, for instance, you drop a hemostat on the floor. Maybe that's your only hemostat. That's a poor example. You can put it in the sterilizer for that same patient. Okay. You would still have to make sure there's no debris, bioburden on it, but then you can flash sterilize it for immediate use. Okay. So that's just one example. So if we're talking about immediate use, steam sterilization, what are those recommendations? Okay, for obviously immediate use. It's not for the next patient. It's for the patient that you're using it on. Okay. You have to be careful with what you put in an immediate use steam sterilizer. So a lot of them will have like the guidelines posted right next to the machine just for reference, but always check your IFUs. If it's like, let's say, a Fraser suction tip, okay, the lumens have to be brushed out and flushed before you put it in, just like a normal steam sterilizer. You always have to have a little bit of water in the lumen so the steam can penetrate the entire tube. Manufacturer cycle times must be followed, otherwise it will not render a sterile item. And then this can be a little tricky because you have to transport it back to the operating room in a way that prevents contamination. So sometimes they're just in a little small mesh tray or basket. You have to have a way that you can sterilely take that basket out of the steam sterilizer and then walk to the OR carefully. Maybe someone opens the door for you or something. You have to do it in a way that prevents contamination. You have to have your mask on when you're doing this. So you've probably heard of AMI by now. I know I've talked about it. So it stands for Association for Advancement of Medical Instrumentation. This is the organization that Central uses for most of their guidelines, for their industry standards, because they're like top notch. So they've done all the research, they've set the standards. So they've come up with these guidelines and they have to be followed. So point of use processing according to the Joint Commission. So that was AAMI. What does the Joint Commission say? So if you remember, the Joint Commission is the organization that accredits every healthcare facility in the US. So hospitals, ambulatory centers, doctor's offices, outpatient, all of them, healthcare facilities, have to be accredited by the Joint Commission. I would personally not go to a facility that's not accredited by the Joint Commission because to me, it shows me that that facility didn't meet those guidelines. They were given a chance to correct maybe some mistakes they were making and failed. So I wouldn't want to go to a place like that. So as far as sterile processing go, in point of use, Joint Commission says you have to document everything. So if a patient comes back with an SSI later, maybe we can trace that back and say, okay, maybe there's a string of SSIs. All these patients were so-and-so, Dr. So-and-so's neuro patients. Maybe they all use the exact same kerosene rongeur. Maybe that means the kerosene rongeurs are not getting cleaned properly. So you can trace those things back if you keep a record of every step that you do. So that is important. Properly clean and decontaminate prior to sterilization. We've talked about that decontamination process, making sure you're following those guidelines with the 3 sinks, etc. IFUs, we talk about that a lot. Lack of instrumentation is not an excuse. So, and that's kind of where it went back to flash sterilizing versus immediate use. Sometimes doctors have to wait. I know they hate to do that, but just because you don't have an item doesn't mean you can just flash it and go on to the next case. It doesn't really work that way. It's not safest for patients. We don't want to do that. We don't want to put them at risk. So if it can't be cleaned properly, it can't be sterilized. So again, going back to your properly cleaning and decontaminating, if you're going to immediate use sterilize something with a big chunk of bone on it, it's not going to be sterile at the end, right? Because living tissue cannot be considered sterile. All right, so these numbers here are something you're probably going to want to memorize before you take your certification exam. They like to ask these types of questions about temperature, time, and in what sterilizer. Okay, so these are the AMI minimum recommended cycle times for your immediate use. Okay, that's the key. For immediate use, gravity displacement. So depending on your facility, you might use the pre-vacuum, you might use a gravity displacement. The temperatures are all the same. What changes typically is the time based on what is in the load. So it's not going to be like a full casket of instruments that you typically have from your other steam sterilizers. These are usually like 1 or 2 small things in immediate use, okay? Something you dropped, something like that. So your first one here is just like non-porcine. We'll just say, for example, a hemostat, your basic clamp, something like that. 3 minutes at 270. So if it's non-porous and porous together, like a plastic or a rubber item, or with a lumen, that's a key, like your Fraser section, it goes up to 10 minutes. Okay, similar to pre-vacuum, except with the porous, non-porous, or lumen, it's only 4 minutes. So other than that, it's pretty similar. And then your steam flush pressure pulse is just 4 minutes as well. So I would highly recommend memorizing those. Okay, so still with our point of use processing, how do we make sure the machines are working? How do we make sure standards are being met? Okay, we have to use your physical, chemical, and biological monitors. You're going to have gauges on the machine themselves. That's your physical. You're going to still put in a chemical indicator strip like you would in a normal steam sterilizer. Okay. They're also going to do the DART test, or the daily air removal test, to make sure that the machine is able to evacuate all that air appropriately. And you're always going to keep record, like I said before, for traceability. So with each load that is run, you will have the patient ID. Usually you can get like a sticker from the circulator, the chart. It goes on the record. Maybe you have multiple sterilizers. They're numbered. Okay, make sure you put that number down. What was sterilized? The parameters that you ran to ensure that maybe that was the correct parameters. You have to list why, and then your signature if you're the one doing it. Okay. So let's talk about high temperature sterilization, because there is a big difference, obviously, between high and low temperature, what can be sterilized in which way. So high temperature is going to be good for obviously things that can withstand the high heat, or steam. So steam is a good effective method. So it's really the most frequently used high temperature sterilization method, because it's cheap, it's easy. So again, with sterilizers, the whole point of sterilization is to kill all microbes, including spores. That is the key, the spores. Okay. So we say high temperature with steam because dry heat isn't used as often. The steam is very effective in penetrating the actual spores and the microbes, to kill them. So advantages, like I just said, low cost. Steam's pretty low cost in water, right? The cycles are quicker than some of the others. Like some of them take multiple hours. It's crazy. Relatively simple in the grand scheme of things, right? And no chemical residue or byproducts. Some of the others use chemicals that are known to cause cancer. So you don't have that with steam. So the components of the steam sterilizer, I would memorize these as well. The three main parts are the jacket, the door gasket, I guess 4, a chamber drain, and the gauges. So the jacket's the outer wall. It is insulated because it is high temperature. The door gaskets at the front, also like sealed and insulated, right? And notice where the drain is. So the drain is usually near the front or maybe the center. And the steam enters from the top back. So enters from the top back, it's going to drain like opposite of it. You're also going to put your indicators, your chemical biological indicators, away from where it enters. You want it to be in the area that's hardest for it to reach. So usually top front is where you're going to put your indicators. Make sure they turn. Then your gauges and monitors are going to be on the outside, just to keep an eye on what's going on the inside, to make sure everything's running smoothly, that you're at the right temperature. So here are other types of steam sterilizers. Okay, we've mentioned gravity and pre-vacuum with our immediate use, but you also have a few others. Okay, you have a smaller tabletop version that you might see in a clinic or an office, or maybe a tattoo parlor. Those are pretty small, but they do sterilize items there. Okay, gravity air displacement is using the concept that air is heavier than steam. Gonna like use for your efficiency there. Dynamic air removal is similar to gravity, but it's literally sucking the air out of the chamber. A little bit higher temp, it says, than gravity. And then pre-vacuum, something unique about this, you have to use the DART, that daily air removal test, or also known as the Bowie-Dick test. It's the same thing. It's just like a commercial brand of it, to make sure that the air is being removed efficiently. Talked about a little bit steam, flush, pressure, pulse. It's a lot to say. And then your immediate use, we did talk about. So typically you won't see the immediate use in the actual sterile, central sterile processing area. You're more likely to see that like maybe between ORs in a substerile room or in like a core area of the operating room. That's where ours were, in the core. Ours was like a racetrack plan. Okay, so just note here, so saturated steam is required for all of these. That means you're going to have a high temperature with steam that's going to increase the pressure. I think it's supposed to be like 27 psi. So the higher the pressure, the more likely you can penetrate that bacterial cell wall. Kill it. All right, phases of the steam sterilizer. We have 4 basic phases here. A conditioning phase, exposure, exhaust, and most of the time a drying phase. Okay, so conditions for these have to be met per the specific sterilizer. So some might vary slightly from, sterilizer to sterilizer. So this is also just as important as knowing like your numbers, your temperature, whatever. How to load the steam sterilizer. You could get all the parameters correctly. You could get the temperature, the pressure, all of that correct. But if you don't load it correctly, you're still not going to have sterile items. So you failed at this point. It means you have to start all over, right? So make sure that you're being very careful with how you load these because you need, it says, the steam to come in contact with every surface. So you can't have things right up against each other that doesn't allow steam to pass between it. So you want to avoid overloading. You can't shove it full because you don't want to run another load, all right? The packaging or the wrapping must be appropriate for that sterilizer. If you accidentally used, the wrapping for ETO, you may not be able to use it in a particular sterilizer. So be careful with what you're putting in there, right? Visible spaces between packs. Notice place hard goods on the bottom. You don't want condensation, I mean, it is steam, from dripping down onto other things. You cannot touch the walls of the inside of the chamber. This is important. Basins are positioned on their side to promote drainage. So you don't want them to be like basin up where all that condensation can just collect. And if it collects too much, it's not going to dry, even with the drying base. Okay. And then stand up paper or peel pouches using maybe a basket or a rack so they're like this and not like a book. You don't want them stacked like a book. I'm on their sides. So causes of wet packs really can go back to, the previous slide, what we just talked about, making sure it's loaded correctly. So when you're trying to figure out what caused wet packs, maybe they're repetitively coming out wet, even after a drying phase. You have to start troubleshooting. A lot of our jobs is troubleshooting. There's always something that comes up. So start with the most likely easiest thing to fix. So that's probably loading, right? Maybe instrument sets were too heavy. Maybe you didn't leave enough space between. You didn't use the right absorbent materials. Okay, so then you can start going down the list and being like, okay, maybe the gasket isn't working, or maybe the drain is clogged. You wouldn't jump, if you're trying to troubleshoot, you're not going to automatically go to, well, that boiler isn't being maintained, let's call maintenance, okay? It doesn't go that way, right? You have to start with maybe the most likely cause, the simplest thing. Maybe it was just you were in a hurry or something. Maybe something got knocked over, leaned up against something else that shouldn't have been. So before you start jumping on like maintenance and being like, okay, we have a faulty gauge, the whole thing's broken, let's call it a day. Start with the easiest stuff, okay? So there's a lot of things that could lead to wet packs. All right, so that was high temperature sterilization. Let's talk a little bit about low temperature. So things that are a little more delicate that obviously cannot withstand the high heat or moisture that might be damaged or completely ruined by using steam sterilization, you could use one of these other options. So ETO is pretty popular. A lot of facilities will use ETO as well as hydrogen peroxide gas plasma. Ozone is a little bit less common, I think, overall, but ETO, which is ethylene oxide, is pretty effective, but this is one that can be toxic, has a longer aeration time, and it is highly flammable. And it has a known carcinogen effect to it. So you have to be very careful when you handle ETO. That'd be a good one to use as one of your chemicals for your paper, your research paper this week. Even this one, hydrogen peroxide gas plasma, or H2O2 if you're into the chemical name of it. The commercial name for this sterilizer is Sterad, okay? Not Steris, the Sterad, okay? Slightly quicker than ETO, good for scopes. And then ozone doesn't require aeration, but ozone gases also can be toxic. So it's just not as common anymore. So we've mentioned the biological indicators before. This is the only true way to guarantee that sterility in this sterilizer has been met. You can put all the chemical indicators you want in there to show that, yes, it went through the load and the load parameters were met, but it doesn't necessarily guarantee sterility. Only the biological indicators can do that because that's showing that literally this little vial, like it's pictured here, is the vial actually contains this bacteria, okay? So the load is showing whether or not it kills that bacteria. So these are the spores, okay? They're spores. So not all bacteria can form spores. So it's, they have to pick the correct spore for the sterilizer. So these are your fun bacterial names. So Bacillus atropius is good for ETO. And then these last two, Geobacillus stearthermophilus. Say that like 3 times. It's really quite a mouthful. Or sometimes it's just Bacillus stearthermophilus. Sometimes they leave out the geo. I've seen it both ways. It's fine. But good for Sterad. It's also good for your steam sterilizer, the exact same one, Geobacillus stearthermophilus, which I did not put earlier. And then ozone as well. So you'll see your biological indicator packs look similar to this. This is just one brand I just threw on here so you could get an idea. So every, depending on your facility, a lot of times you have to run a biological in each sterilizer at least once a day, at least every 24 hours. So, and some of these now, like before, I would say within the last 5-10 years, our indicators, maybe 10 years, used to take 24 hours to read or 12 hours to read to see whether or not it was effective. Now they have rapid readouts, like 3 hours, some of them. So that's really handy if you're trying to keep up with making sure, no one's getting an SSI. That's really important, right? So I'll show you a video later about how to read those. So this is the end of our Unit 4. If you guys have any questions on any of these items or your project that's coming up, your research paper, please reach out. I did send out quite a few emails to several of you just because you didn't turn in that decontamination video. Even if you had an A before that and you got a 0 for not turning that in, it dropped your grade to failing, okay? It's because of how the grades are weighted in this course. They are weighted a little more heavy on those types of projects as opposed to like discussion or just your homework. So get those turned in. I will still accept those, okay? I'd rather get turned in instead of you failing. So if you have any questions about that, just reach out, okay? Have a good day. Bye.